Hi, so this is my pocket guide video for NU 664 Fall 2020. I actually added it on to my previous pocket guide from health promotion and disease prevention, so I could have all of my resources and references in one spot. So for each section that I did, I made a little table of contents so I could know where to find what I need. So for my first section, it's respiratory, HENT, and allergies. First, I discussed community-acquired pneumonia, COPD, asthma, sleep apnea, and I discussed the signs and symptoms, what you would find on a physical exam, tests and diagnostics, and treatment for each one. I also talked about smoking cessation, the different treatments, pharmacological and behavioral and alternative treatments. I then moved on to the ears and discussed otitis media, otitis externa, and those findings and treatments. I then discussed different types of coughs that you would have, like croup, bronchitis, and bronchiolitis, and again, the treatments and physical exam and symptoms. I then also discussed different eye conditions that we learned about, and same thing, the treatments and signs and symptoms. And then lastly, I discussed allergies versus food intolerance, and the treatment and follow-up and management of that. My next section is I went on to family planning as well as sexually transmitted infections. So I started off by with the natural and non-hormonal methods of birth control, and then I moved into the hormonal methods, the different types of oral contraceptives, the progesterone only and the combination, also the Depo-Provera shot, the Nexplanon implant, IUDs, patch and the ring, and advantages and disadvantages of each, and also who is a good candidate and for which patients these would be contraindicated for. I then have information on barrier methods, permanent methods, surgical like tubal ligation and vasectomies, and then also pregnancy termination, pharmacological and surgical. And then I have information on STIs, screening, who needs to be screened, when they need to be screened. And then also I have information on gonorrhea, chlamydia, herpes, HPV, pelvic inflammatory disease, syphilis, vaginosis, vaginitis, and cervical cancer. And then again, for each one, I talked about the sign, and I have some information on the signs and symptoms, what you would find on a physical exam, the tests and diagnostics, and then education and prevention, and also treatment for partners as well. My next section is cardiac. And I start off with information on hypertension, hyperlipidemia, and the different causes, when screening should begin for each of these, signs and symptoms, physical exam, treatments, tests and diagnostics, and complications. I then have information on valvular disease, aortic stenosis, mitral regurgitation, mitral prolapse, and mitral stenosis. And then what you might hear in terms of different heart sounds and murmurs, signs and symptoms, the physical exam, treatment, complications. I then have information on chest pain and what the differentials might be, and what the follow-up or treatment would be depending on what the diagnosis is. I then have information on the 12-lead EKG, how you would read it, how you would interpret it, and what it could, what the implications might be. And then lastly, in this section, I have information on thrombolytic events, what the risk factors are, signs and symptoms, physical exam, diagnostics, and the treatment. And then also I have information on pregnancy considerations for thrombolytic events. My next section is gastroenterology, and then I have information on, the anatomy and what discomfort and pain in different areas might signify. So in this section, I discuss appendicitis, aortic aneurysm, cholecystitis, C. diff, cholelithiasis, diverticulitis, pancreatitis, constipation, peptic ulcer disease, ulcerative colitis, IBS-C, IBS-D, and Crohn's disease. And GERD. And again, the different signs and symptoms, what a physical exam might look like, the tests and diagnostics, and the treatment for and management for each one of those. And then my next section is about the thyroid. I discuss hyperthyroid, hypothyroid, signs and symptoms, physical exam, tests and diagnostics, and the treatment for each one. And then I talk about pediatric considerations for these, so screening and management for that. And then I move on to diabetes, my diabetes section. I talk about type 1 and type 2, the differences and the pathology for each one, the risk factors, signs and symptoms, physical exam, tests and diagnostics. I talk about treatment, so pharmacological treatment and lifestyle management, different medications, injectables versus oral, glucose testing and education how you would teach someone to manage their blood sugar and check their blood sugar, and then different complications, microvascular and macrovascular, and what the follow-up and the referrals that you would need to give to these patients. I talk about gestational diabetes, screening, treatment, fetal complications, and follow-up for that. And then I also have information about pediatrics when it comes to diabetes. My last section focuses on pediatrics. So I talk about GU, so hypospadias, retractile testicles, inguinal hernia, hydrocele, testicular torsion, UTI, again, signs and symptoms, physical exam, testing and diagnostics, and then treatment. GI, I discuss constipation, diarrhea, abdominal pain, and GERD. I talk about neonatal hyperbilirubinemia. I have a section on cardiac and chest pain and what the differentials could be, and the diagnostics and treatment and follow-up and management. And then I have information on Kawasaki disease and rheumatic fever. So that is my pocket guide so far for this semester, and I look forward to adding more to it as we finish out.